again, joining us this morning is Dr. Kothary, the Chief Medical Officer for Dignity Health Central California Division, and he has been joining us talking about the latest on the coronavirus crisis here in Kern and California. Thanks so much for joining us, Dr. Kothary.
Well, thanks again for having me again, Alex.
I want to start with the 3 new deaths reported yesterday. They didn't happen all at once. It was spread out. We just got the results, though, yesterday. That brings our total to 11. What does this mean for us here in Kern County as we continue to move forward to possibly going into the second phase of reopening while, again, our death rate continues to go up?
Yeah, well, we still have a lot of sick people in our hospitals, and that's you can't discount that at all. We're doing everything we can to take care of these patients in the intensive care unit and make sure they get better. But unfortunately, some of these patients are extremely sick.
Well, speaking of intensive care unit, according to the California Department of Public Health, 21 people in Kern County are in the ICU right now. They say that trend continues to go up here in Kern County. What's interesting, though, Dr. Kothary, is the State Department of Public Health said that California actually saw a decline in hospitalizations and death over the last week, while Kern's continues to go up. What does that mean for us here in Kern County?
What we've seen at our Dignity facilities, I don't know what's going on at the other facilities, is we've flattened out. We haven't seen an increase in the ICU admissions. We maintain the same number currently. But what you'll see is, I think that trend will start slowing down. As one of the advantages we have in Kern County is our weather. As it warms up, this virus will slow down.
One of the things that a lot of people are talking about right now is possibly reopening the economy. And the governor has laid out 4 stages on reopening, the 4th stage being completely lifting the stay-at-home order and resuming life as we once knew it. There's talk about gradually going into phase 2. And now there's, talk about what that may look like, what should be in phase 2, what shouldn't be in phase 2. And one of the things that we've seen even locally are a lot of people talking about going back to church. A lot of people want to go back to the physical building, the physical church building. And some are still on either side of the discussion, saying that we should be able to go back to church. And some who say we're not at that point yet. It's phase 3. We're about to go into phase 2. What are your thoughts on going back to church? Is it too soon to go back to church?
It just depends. The churches have to be socially responsible. They've got to make sure that they maintain the social distancing. I think if they maintain that, which unfortunately in churches is hard to do, you get to run into people, you want to hug them, you want to pray with people. It's tough, but I think if they can maintain that social distancing, I don't see why you couldn't go back to church. I think, a lot of people are hanging their hats on prayer, and I think that's one of the most powerful things we have currently.
One of the things that we heard from Matt Constantine, the director of Kern Public Health, he said that the idea is to get more testing capabilities across Kern County so we can test as many people as possible. And he said, we're going to see more people test positive for coronavirus, and that is a good thing. Can you kind of explain what he means by that as we continue to move forward?
So what we anticipate what we're speculating, like with other viruses and other illnesses, is when you get a virus, if you have mild symptoms, you'll still develop antibodies to the virus, so that when it comes around the next time, you'll have some protection. We don't know exactly what this virus is doing. We don't know how strong the antibodies are going to be and what your immune response is going to be the second time around. But we're basing everything we know off the past coronaviruses that we've had, for our common colds. The problem is these viruses tend to mutate, and when they mutate, our immunity does waver a little bit.
And we've already seen reports talking about that this virus may be mutating already. What does this mean for us as we prepare to go into the summer where traditionally, and you've even said before, things kind of quiet down, but then once the fall and winter come, things could ramp back up again. So what does this all mean for us as we head into the next several months?
Well, I don't think the governor's 4-plan approach saying that we'll go life back to normal, I don't think that we ever go back to normal. I think this has changed the way we live now. But we are anticipating potential medications that will help shorten the course of this virus and make it so it's not so severe as well. So I don't believe the vaccine will be around by the end of this year. I don't think it comes around before 2021. But, I do anticipate a lot of different companies manufacturing drugs that will help.
There is, again, a lot of confusion over what phase 2 means and what businesses can open and reopen. The county says that they're working on the plan, and they will, release more information once the governor releases more information as soon as tomorrow. But what is your message to everyone as we enter this new phase? A lot of people think that this is simply turning on a switch and reopening for business. What is your message to everyone as we enter this new phase?
And I think that's where the confusion lies. I think a lot of people do feel like as soon as we open, everyone can go out and do whatever they want. The message that all of us are trying to relay out there is we've got to maintain the social distancing. We've got to be socially responsible for our neighbors. I think, it's going to be tough, but we have to do it. And the owners of restaurants and other businesses have to make sure that people do social distance. The responsibility is going to fall a lot on them as well.
All right, Dr. Kothary, and just a reminder to all of you at home, Dr. Kothary will join us on Facebook Live this morning at 7:10, answering your questions live. So make sure to tune in on our KGET Facebook page at 7:10. He has been gracious enough to join us and answer a few of your questions for a few minutes. So, Dr. Kothary, we will see you on Facebook in about 30 minutes.
Thank you so much, Alex.
All right, thank you. We're back with